Thank you very much for sticking around. This is your Medical Monday with Dr. Asfa. Doctor, thank you very much for joining me.
Thank you very much.
And today we're talking about male breast surgery. And there's a few topics I guess we could go over first before even delving into this, right?
That's right. We have about 4 or 5 topics that needs to be addressed. One of them is male breast enlargement. We call it gynecomastia. If you look at the first picture, that the anatomy of the male, as you see, the same thing with female, but male, they have less amount of the breast tissue, and it's a combination of breast tissue and some fibro-fat tissue. So in male breast enlargement, we go and remove that excess amount of the fat and breast tissue. What usually they say, they have some social embarrassment, they don't want to take
It's all mental, it's not so much, I guess, an ailment, right?
That's right. And it doesn't matter what age. We have patients that from age 11. I have a patient that he didn't want to go to school because he was embarrassed, get picked on by his classmate. Right. And usually it brings up to their family physicians, and we do some examination, make sure there's no cancer or any hormonal problem going on, and we can treat that issue for them.
Okay. But I guess an important point, too, you'd like to see the body mature first, but again,
absolutely,
it's not binding there, right?
Because they are going through the hormonal changes during the puberty, and you don't want to touch the breast because most of the time that shrinks down.
Okay.
But at age 20, if still the hormonal problem is nothing issue, and we can go. As you see the picture on the left side, this is before, and on the right side after. This is gentleman, about 35-year-old.
Okay.
And he had that problem, and it was fixed by surgery. The same thing, this is a 21-year-old gentleman who had enlargement of the breast bilaterally, and the pictures showed that I would say about 6 months after surgery.
Wow, okay. And a good thing to talk about here, too, a jumping off point, with female breast enhancement, or whenever you talk about that, you're always talking about the fear of cancer.
Absolutely.
And that's also something that men have to worry about, right?
That's right. Male breast cancer is not common compared with the female breast cancer. In 2008, the total amount of the male breast cancer diagnosis was less than 2,000. And the total amount of the death related to male breast cancer was 480, compared with 40,000 people, female, who died just because of the breast cancer in 2008. How do they diagnose that? Usually it's very small, firm, non-tender mass right under the nipple. They feel something, they should add this to their family physicians, and they go through the process of diagnosing, X-ray and biopsy, and if it's positive, we manage them as a female breast cancer treatment. Okay. Good thing is they don't need any kind of reconstruction because we decrease the size.
But I guess in terms of construction, though, something unusual in males, I guess males out there might not think this, but implants are also an option.
That's right. Implants, usually the pec implant for the people, if you go to the picture, the pectoralis implant, for enhancement of the chest. People, they go to gym, they do lots of workout, and they don't get the shape that they want to get. So we use this one as a male pec implant. Okay. As outpatient surgery, of course, is some foreign body, but they get better shape of the chest. Yeah.
Well, thank you very much, Dr. Asfa.
Thank you very much.
Always an education. I really appreciate you coming in.
My pleasure.
Dr. Asfa Surgery, 30 Boyers Road, Harrisonburg. Number right there, 540-432-0303. And before